Good evening, everyone. Thank you for joining us today. Today, we're going to be talking about gender-based violence. Joining us today is Dr. Laima Christopher, who is a consultant obstetrician and gynecologist. Welcome, sir. May we know you, sir?
Thank you. My name is Dr. Christopher Laima. I'm an associate professor of reproductive health at the Gombe State University, Department of Obstetrics and Gynecology, and also a consultant obstetrician and gynecologist with Federal Teaching Hospital, Gombe. I'm the head of the Reproductive and Gender-Based Violence Unit of the hospital, and also a member of the State Steering Committee for the prevention of gender-based violence in the state. Thank you for having me.
Thank you, sir. To begin our conversation today, sir, in the Nigerian context, how would you define gender-based violence for a typical Nigerian, and why is it an issue that should concern Nigerians?
Gender-based violence is generally defined as any form of harm or torture
Yes, sir.
or inconvenience perpetrated on any person because of their gender. The emphasis here is the insult that is done is because of the sex of the person, whether male or female. So if it is in that context, we call it gender-based violence.
Thank you for laying that foundation, sir. So just to make it easier for the audience to understand, because most of the questions we got, people usually assume that gender-based violence is just limited to women. So gender-based violence is for both sexes, whether you're a man or a woman.
Yes.
Thank you, sir. Well, moving on, what are the most common forms of gender-based violence you see in the Nigerian homes and communities, especially those that may not be recognized as violence?
There are mainly like 4 to 5 forms of gender-based violence.
Okay.
The first one is physical gender-based violence, which is what most people know.
Okay.
And it has to do with like beating, physical harm, like wife battering or husband battering, and child abuse at home because of gender. So that's what is called physical gender-based violence. There is also sexual gender-based violence, which involve things like rape, things like attempted rape, things like threats, or every form of threats, like grabbing of parts that shouldn't be touched without consent. Now, the third one is a financial violence, which has to do with deprivation of resources because of gender. For example, a man and a woman, if there's a power situation where the man will deprive the woman of resources for her to take care of herself, it's also considered gender-based violence. And of course, there is intimate gender-based violence, which has to do with in a marital setting, where a man and a woman, there is power struggle, and one is hurt because of that. Other forms of gender-based violence has to do with deprivation of like inheritance, some cultural practices that are wrong, like female genital mutilation, widowhood disinheritance. All this constitutes the form of gender-based violence that we experience in Nigeria.
That's a lot, because most people have a limited view of what gender-based violence, but I think after your response here, sir, we know that there's so much more involved in gender-based violence. How widespread would you say is gender-based violence in Nigeria, sir, and why do so many survivors keep quiet about it?
Well, the first question about the incidence, gender-based violence, when you take like four women, you find that at least one of them has experienced a form of gender-based violence. So it's very, very common, like 30 to 40% of women. It's a bit lower among the male. It's like 1 in 12. So gender-based violence, even though all the genders are affected, mainly it affects women. Now, let me put it more graphically. If you enter a room and you ask like 4 women to stand up, one of them is a victim of gender-based violence. That's how prevalent it is. And why, with this prevalence, we discover that still many people don't know about it because it's there. Now, the problem with gender-based violence is that many people don't want to report it because it is it's attached with stigma. Yeah, for example, now, if you have a situation whereby there is rape in the family, the first thing is try to cover it so that people will not know. And even the ladies, perhaps in case of rape, you don't want to come out and say, I've been raped, because people are concerned what will happen to you when you want to marry, what will happen to you in the society, and stuff like that. So there is less than like 5% cases of gender violence are actually made public. Majority of them are kept secret because of stigma.
Stigma. Oh, that's a lot, if I should say so. So what would you think, because you said less than 5% are reported, so what would you think are some of those cultural, social, or economic factors that will make it become underreported?
Yeah, there are many factors. For example, let's look at wife battering. Wife battering, for example, if a woman is not economically empowered, and she's experiencing gender-based violence at home, I can say 90% of cases are managed. At the end of the day, the woman will refuse the case to be reported to the police. She refused the case to even be mentioned again. At first, when she's angry, she wants everybody to know, but later, before we settle, they will settle among themselves. And if you ask her why, say, oh, I don't have anywhere to go. My parents are not, I don't have a means to take care of myself, so I just have to stay. And the other factors do with when we talk about wife battering is about children. There's a belief that a woman should suffer everything for her children. I'm not saying she shouldn't suffer, but sometimes it leads to death. Now, when it comes to issue of rape, it has to do mainly with the fear of what will people think about me. And then the society blames the victim. For example, if a lady is raped, the first question people ask her, what were you doing? What were you doing at that moment? Time. Who took you there? How did you dress? Didn't you know there is danger? So they decide to keep quiet because the society does not protect them. The society will not stand for them. Rather, the society will blame them when actually they are victims.
Makes sense. So how would you say, what are the physical, emotional, or social effects that is mostly seen on victims of gender-based violence?
Well, depending on the type of gender-based violence. If it is physical gender-based violence, of course, many have died. We have had situations where the man killed the woman or the woman killed the man. And all these are forms of gender-based violence. So actually, it can lead to death. It can lead to loss of body parts, injuries to the eye. Some have lost their eyes. Some have lost their mental reasoning because of the trauma to the head. Some have lost many functions of the body. So physically, it can lead to death. It can lead to loss of function of particular. But the commonest issue about gender violence is the psychological trauma it causes on them, because it leads to depression. It leads to panic attacks. They lose confidence. If they are children, some of them will drop out of school. Some of them will not be able to keep themselves and do anything for themselves. It has been argued that one of the economic impacts that we have in our society, both in the family, is because of gender-based violence. People come to work and they cannot put in their best because they have been abused at home. And then people will not understand what is the problem. They will tell you no problem. But it leads to economic loss to the nation, to the society, to the family, and so many things. Now, when you come to rape as a form of gender-based violence, of course, you know that after rape, there's a tendency of death too. Some women lead to death. Some will contract a lot of diseases like HIV, gonorrhea, syphilis, even human papilloma viruses can be transmitted through it. Now, the other things are infertility, because these infections can cause infertility. Later, you discover that the women cannot give birth. That's what we call chronic pelvic pain. Women will be having lower abdominal pain for a long period of time. The treatment is usually very, very difficult. So these are some of the physical, emotional, and psychological impact. Let's not even mention unwanted pregnancy that may lead to dropping out of school. It may lead to abortion. abortion will lead to his own complication.
Complications.
So gender-based violence actually has a lot of psychological impact on the society.
Which doesn't really tell on the human.
It doesn't really just know the reason, but those of us who work in the field, we can almost attribute the decay, the backwardness of society by the presence of what? Gender-based violence. Without gender-based violence, the society will certainly be a better place.
True. I can understand with that. I can understand because the trauma goes deep. It goes deep. So, sir, what would you say? How does exposure to violence for girls affect children growing up in Nigerian households?
Of course, when children who grow in the atmospheres of violence, let's say physical violence between the couples, it has a lot of problems. Now, when you go and the research has shown, when you look at inmates, prison inmates,
yes.
Terrorists, when you look at armed robbers, kidnappers, we discover that majority of them are from families that were exposed to gender-based violence. Apart from that, when you also look at it in the prism of the impact it has, you discover that it is very, very severe. Now, when you look at school dropouts, many children will not finish the school. And the last thing I want to mention on this is prostitution. A high number of prostitutes that we have around, we discover that they're actually victims of families that there was gender-based violence that is involved in it.
So childhood trauma. Following them into adulthood and shaping who they become.
There's a study that has been done about, for example, children who are molested when they are young.
Yeah.
You know, there are some of them who would now grow up, even they will grow up to become perpetrators themselves. For example, a boy who grew up in a family where the father does violence to the mother, he will grow up and also be a perpetrator of violence. Yeah. And the girls who grow up, somehow they become victims of violence, the same thing that was experienced in their families.
Could it be maybe because they were used to it and they see that it's nothing too...
Yeah, these are some of the factors. That's some of the factors.
Sir, if someone is experiencing gender-based violence now in Nigeria, generally in Nigeria, what can they do realistically to ask for help? Considering the fact that there's so much stigmatized, is there something they can do in order to reach the appropriate people they need to reach without becoming public?
Yeah, I think the most important thing is awareness, like we're doing now.
Okay.
And we encourage people to speak up. But they must speak up in a place of their convenience. For example, now, if it has to do with bodily harm, you go to the hospital first and you tell the doctors. But you must open up. They can call the doctor in private. Because most women, for example, will come with wounds in their bodies. When you ask them what happened, they say they fell down.
So many stories.
And then you look at, you know that this is not normal, but they will never open up. We're encouraging these women to open up too. Every hospital in Gombe State has a gender-based violence focal person. They will call the person and he will be able to help. Now, other places you can go is police station. Sometimes we report to the police station and tell them this is what is happening. But apart from the police station, there are religious and community leaders that people trust more. You can go and meet them and tell them your challenge. Those ones, we have, like I mentioned, the Gombe State steering committee. It's made of lawyers, it's made of policemen, security, made of medical personnel, it's made of media, and all these people. So we have a communication with all of them, whatever you need. In fact, there is NGOs that offer housing if you are threatened for a period of time. So for you, it's just for you to link up and let people know what the problem is.
So opening up is the first step. Once they open up, there are measures in place that can actually help them, take themselves out of the situation till they are comfortable to go back if they so wish. Thank you, sir. Sir, what role should men, community leaders, religious leaders also, and families play in preventing gender-based violence?
Yeah, let me start with men.
Okay.
Because majority of the perpetrators are men.
Okay, sir.
Now, men must be educated on gender-based violence. That's what is called male dominance or patriarchy, as we may call it.
Yes.
And we need to understand that most of those things are not religious but cultural. And we need to understand very well that men have a role to play. They are called to be loving, to be caring, and to be protectors, not to be perpetrators. So there must be sessions where men are taught their role in the society, and they must imbibe it. There are many things that happen that men laugh about it. Like rape, some will just laugh and say it's one of those things. Like wife beating, they will just laugh and say it's our culture. Some will even say it's our religion. But if you look at the matter critically, men have a role to play. They need to be understanding and they need to be at the forefront because women cannot do it alone. As you can see, I'm a man. I'm in the forefront of gender-based issue.
Yes.
Now, religious leaders too. Religious leaders in the churches and the mosques, there's a need for awareness. They can call experts to come and talk to them about these things because some of those things actually they do not know. I remember we have a meeting with the religious leaders when the Gombe State VAP Act is being proposed. And the issue of rape came, that can a man rape his wife? I like to say this. And there was a lot of argument based on religious and cultural. And many are saying, no, a man cannot rape his wife. Then I remember standing up and saying something that made them, I said, you are looking at rape in just like giving consent. What of other instances of abnormal sexual intercourse? What of oral sex? What of anal sex? What of some bizarre things that some men insist or some women insist? Or prison sex. You want to tie the person with chain and stuff like that, and even beat in the process. And I asked them, are all these ones not rape? And there was dead silence there. They now understand that the issue of rape, even within marriage, is something that can be visited. So experts, the churches need to be enlightened, and they need to teach their people more on that. Now, culture is very, very important. Culture is very, very important. We support culture as long as the culture is good, and we must handle it with care and with caution. So, but we advise that there's a time to sit down and dialogue. What are the benefits of this culture? Positive culture are encouraged. Negative ones are discouraged. But it will take some time for that to achieve. And of course, I want to mention the role of the media. The media is very, very important because the media, as this message is being transmitted, people are becoming very aware. Gombe is doing very well in that regard, and we hope it continues.
With you at the forefront, sir, it will continue. Yes, sir. So, sir, we've talked about, we've seen how communities, religious leaders can be at the forefront of this. What about when we look at the individual himself? What actions can the individual, like a woman or a man, what action can they take today that can help to reduce gender-based violence?
Well, I think the main thing is the culture of silence must be dealt with. One, people must speak out. People must speak out. When it happens, we say you may hide it because you think maybe you're protecting yourself. But at the end of the day, the perpetrator will go and do like 10 more.
You're protecting the violence.
So if you come out, you're actually reducing it. But if you decide to keep silent, you're actually perpetuating the cycle.
More like breaking the chain with your...
Yeah, if you come out, you break the chain. So it's very, very important that the culture of silence must be reduced. The other one is stigma. Individuals must shed the stigma away and say, I'm a victim, I'm not a what? I'm not the problem. I'm not the problem.
I'm not the problem.
I'm a victim.
Yeah.
If we change this mindset, because now we call them survivors, gender-based violence survivors. That's the terminology that people encourage. Even though many people are saying they are still victims, but they are victims and they are survivors. So these two things will help. Culture of silence, then we must shake away stigma.
Thank you very much, sir. Well, we have heard from the expert himself about what he can say, what he said about gender-based violence. I hope this session was educative, and I hope you understand that silence in itself, it's just protecting violence, and speaking of conversation is part of the solution to the problem. Thank you very much for coming here today, sir.
You're welcome.
Your presence is highly...
You're welcome.
I'm not on camera anymore. This one is me and him.